Very good evening, friends. Meeting again in the session of Materia Medica. And today we're going to learn one of the important Indian remedy or Indian drug, which is not mentioned anywhere other than the Materia Medica at the end of Borix Materia Medica, at the end, wherever the 50 Indian drugs are mentioned. One of the important remedy in diabetes with its complications is Abroma Augusta. This remedy is a very useful remedy in specifically in female complaints as well as in urinary complaints, the diabetes and its complications, specifically the renal pathologies which develops because of that. It is a wonderful remedy. I will going to share one case which I have treated with this remedy with 30 potency. It was way back when I was reading D.P. Rastogi sir's book on indigenous remedies or Indian drugs, and he has worked a lot on Indian drugs. With that, I have read about this, and then I started utilizing this Abroma in my practice. This one day, one patient around 40 to 42 years of age, he was a professor who came to me with a puffiness over there and on the face, on the body, and he was known case of diabetes mellitus since 5 years before that, and now developed a renal kidney incompensation. There was albuminuria, and that's why the puffiness was there, and the creatinine was increasing, and he was tremendously disturbed. The mood was morose, little bit disturbed because of disorder. He was having, along with that, since 3 years, impotency as a complication of diabetes, and he was not so debilitated as we used to find it out with the acid first. Yes, he was having a weakness out of that, but at the same time, basically, the albuminuria was very much. He used to, he has explained that many times he forgets the things since last 1 year, and there is a little bit um, vertigo sensation, or sometimes I'm feeling that something is moving over there. That feeling was there with him. But along with that, he has an unnatural craving for food, very hungry. So these are the features with which he was presented to me. And specifically during that time, I was reading that book and I have read about the Abroma Augusta. Before that, I have not used the Abroma. That was the first time which I thought is this patient will start with the Abroma and let us see what happens with Abroma. Because it is typical diabetes with the renal complications, little bit hypertension. And this fellow is a good case to be considered in diabetes with the kidney complication. So I have started Abroma in 30 potency and I have given it for a period of week. Before that, he was already on anti-diabetic. He was already on many medicines. He has consulted the diabetologist, then they have started many medicines. His creatinine was at little bit high. It was really coming to 2, and he was little bit worried about that. So since 4 5 years he was on under allopathic treatment. So I have asked him to meet me after a week or 10 days, and he came for follow. And this time he was looking quite good. The puffiness of the face was remarkably disappeared. It was not even seen. His eyes, which were seen little bit dull, the darkness around eyes and with puffiness, and that face had changed completely. So I asked him to do a blood sugar, the random blood sugar was around 165. I have kept him on placebo for 15 days. I asked him again to meet me after 15 days and asked him to do a reports before coming to me, the fasting blood PP blood sugar and along with serum creatinine. So he was checked for all three things after 15 days and he was having creatinine 1.8 in the same lab. The blood sugar, fasting blood sugar was nearly about 90. The PP blood sugar was around 140 and he was in good control. So I started reducing his allopathic doses and I have repeated again for a period of 3-4 days the Abroma along followed by placebo. I asked him again to meet me after 1 month. And after 1 month, when I checked again the blood sugar even after reducing half of the tablet of anti-diabetic, it was again found to be a similar. The fasting blood sugar was 90 and PP was nearly about 136, 137. And the creatinine was little bit reduced. Again, it was 1.5. So he was improving in a natural way. Within span of 6 months, his anti-diabetic tablets were stopped. His kidney, which was getting compensated, which was again settled, and his creatinine level was 1.2 after 6 months. And the total puffiness has vanished. But most important thing which happened after that, that his impotency got vanished. It means that remedy has acted at the root level. It means it has produced or it has removed all the complications of diabetes. And then I have a quite confidence on using the Abroma in such types of cases. Many times it comes very close to the uranium nitricum, where you get all those similar types of features. Another remedy which you can think in such types of cases is Helonius. Specifically in females, if it is there, the Helonius also comes as a compound similar remedy. There is one Syzygium, Jambolinum, Gymnemna, Separanda indica, all those remedies are there. But this remedy, specifically an Indian remedy, having a very wonderful action on all those things. So we'll study this Abroma Augusta from the Borix Medica. At the end, it has been given in the Indian drug. It is also the common name is Ulat Kambal. It is a Ulat Kambal means why it has been given. I will show you. I will share something which is there with me. So this is another common name is Devil's Cotton. This name is specifically mentioned over there. It is Devil's Cotton. Why the picture you can see how it is called as or how it looks like. I will show you. It is a uterine stimulant and specifically indicated in amenorrhea and oligomenorrhea as recommended by Indian Ayurveda. Due to its pain relieving activity, it is also given in dysmenorrhea. The root bark of Ulat Kambal is valuable immunogogue. That is, it increases menstrual flow and uterine tonic, chiefly used in intrauterine diseases and other gynecological disorders, mostly related to menstrual disorders such as dysmenorrhea, amenorrhea, and gonorrhea. Powdered root is an abortifacient and anti-fertility agent. And this is the picture. This is how it looks like. It is called as devil's cotton. A single picture of the specific, it looks like this. It looks like kambal, ulat kambal. So that's why the name of the remedy is ulat kambal. So prover Dr. D.N. Ray, an Indian prover, he natural order, it is Turriculaceae, it is Malvaceae family, Malvaceae. Clinically, albuminuria, sleeplessness, amenorrhea, carbuncle, diabetes mellitus, diabetes insipidus, debility, dysmenorrhea, and weakness of the brain. Mind, irritable, excitable mood, ill humor, forgetfulness, absent-minded, depression, the morose look on the face, and anxious, moody. There is one word which has been wrongly printed over there, unable to. That word you can remove. It is moody. That is, mood is quite changeable, variable. Head, there is empty feeling, the rolling of head and vertigo, heaviness and discomfort, much giddiness. So features generally related with the diabetes, which you can very commonly seen. These are very commonly seen in this remedy. Eyes, the weakness of vision, there is puffiness of the lids, the heaviness, eyes easily tired, inclination to drop eyes closed, pain and watering from the eyes, conjunctiva becomes pale. So there is a little bit heaviness of the lids and lids fall down. That is one important feature which you can see. Some shortness of hearing in the ears, buzzing in ears, discharge from the ears, that is otorium. Nose, the sneezing several times, watering, dryness of the nose with desire to rub the nose. Face is pale, yellow, wrinkled, old looking. Itching eruptions on the face with burning sensation, the furuncles of the face. So it is a typical remedy for diabetic carbuncles, furuncles, the diabetes and its complication over the skin, and this is wonderful remedy to be thought of. Throat, dry, burning sensation, painful, difficulty in swallowing solids, but drinking relieves throat symptoms temporarily. Looks like to be like a lachesis. The throat symptoms are looking like lachesis, looking like Barretta carbonicum, where solids can be easily digested, but liquids are painful over there. Sorry, liquids relieves the complaints and solids affects against it goes against the lachesis. Mouth, almost constant dryness of the mouth, typical feature of diabetes. Drinks large quantities of cold water at time, yet dryness persists. Dry and clean tongue, indistinct speech, lips dry and bluish. Here it comes, looks like to be a bryonia. The bryonia features which you can catch easily over here. Appetite, unnatural appetite, can eat short after good meal. Stomach, hungry feeling with faint feeling. Desire for all kinds of food, a feeling of emptiness in stomach. So, all gone sensation is very common with this remedy. Abdomen, flatulence with distension in abdomen. Stools, constipation, brownish black, knotty, hard, lumpy stools with much straining. Here again it goes in favor of bryonia. So many times many features looks like bryonia. Most important features are urinary. Profuse urination day and night, frequent urination, dryness of mouth and great thirst, desire to drink after urination, which relieves the thirst, urination to lead exhaustion, the fishy odor of the urine. This is very important. Slight sediment, diabetes mellitus, nocturnal enuresis, burning in urethra, white ulcers in the mouth of prepuce caused by excessive passage of sugar in the urine. Inability to retain urine. Generally, this is common features in males who suffers from diabetes. They have a glans penis where the whitish appearance of the eruptions comes over there, and that is a common thing with which person understand that the sugar is increased, and this can be settled very easily with the abroma. This is a wonderful remedy to be think of in such types whenever you find such types of features in the patient. Heart, weakness of the heart, the palpitation worse on movement, there is faint feeling. So weakness of heart, the little bit failure signs which you can get over there. The respiratory, cough with purulent expectoration, pain in chest, lumpy sputum, white and yellowish in color, worse in cold air, aggravates in the evening and night. So cough which is getting aggravated evening and night, during coughing the patient presses the chest. He always presses the chest. If he holds the chest, that is more of a bryonia. If he holds the larynx, it is of a allium sipa. So here patient presses the chest. Skin is dry skin, scratching, burning, small boils in summer, carbuncles, and these are typical diabetic carbuncles. So diabetes with its complications, carbuncles, furuncles, these are very important things which are present in Abroma Augusta. Neck, back and limbs. Dull pain in back extremities, emaciation and weakness of the limbs, pain in the kidney region. So there is lumbar loin pain which you commonly get over there. Male sexual, absence of sexual desire, inability to coition, becomes exhausted after coition, swelling and hanging of the testes. So weakness in genitals due to the diabetes, one of the important remedy other than acid phosphoricum. But in acid phos, the debility is tremendously marked than the abroma. Female sexual symptoms, irregular catamnia, catamnia menses, blood is dark clotted, profuse or scanty and pale amenorrhea or dysmenorrhea. Leukorrhea profuse, white, thin, watery. Chlorosis, so associated with anemia. Colicky pain in lower abdomen 2-3 days before the menses. Hysteria is associated with menstrual disorders. Very, very specific. Pain starts and patient goes into the hysterical spasms, hysteria. These are very typical features which you can get in abroma. Sleep, there is drowsiness associated with insomnia. Prostration and aversion to do any labor. So he doesn't have a strength to do anything. Unrefreshed sleep, sleeps better in early part of the morning. This is very important. He never get good sleep till late night, and early in the morning he get a very good sleep, but never remains to be fresh after the in the morning. Fever, there is dry heat over the whole body with associated with great thirst. The potency of choice is mother tincture 2x or 3x, but I generally suggest it is good remedy even used in 12C or 30C. Wonderful remedy I have used. Then relationship is not mentioned, but my thought regarding it is compare this remedy with Syzygium jam. Then most important for comparison is uranium nitricum. The third remedy you can think is Bryonia, the Gymnemna sylvesteria. That is another Indian remedy which you can compare with it. Helonius is another remedy which you can compare with this remedy. So specifically in diabetes associated with the renal complications, one must think about the abroma and use in their practice with very successful results. So one more remedy from fourth year syllabus, a wonderful remedy which is there in syllabus. I am very happy that this has been included in syllabus because it is not there in rest of the materia medica, but still it is included in syllabus. That's a good thing because we get acquainted with such types of remedies if they are there in syllabus. Many times the syllabus remedies we never, other than syllabus remedies we never looked. But if we read such types of remedies and use it practically in practice, they always helps and increases the confidence in prescribing. So that's all for today. We'll meet again tomorrow with another next remedy. I think it might be abrotenum next remedy. So we'll learn that remedy in tomorrow's session.
Sir,
Yes.
hello, sir.
Hmm.
Hello, sir. I have patient, one female patient, 65 years age. She is having generalized weakness and looking little bit pale. So I investigate her for CBC in urine.
Hmm.
On HB is a 9.2.
Hmm.
And in urine, sir, there is a proteins 4 plus, occult blood is 4 plus, crystals 25 to 30,
Hmm.
and bacteria is present.
Hmm.
Then I advise them today to do UHG of abdomen
Hmm.
to look any renal pathology or म्हणजे एवढं bleeding blood आहे म्हणून.
Hmm.
तर on investigation UHG there is no any calculus seen in on UHG.
Hmm.
In renal calculus there is no any renal calculi.
Hmm.
Then what should be the reason, sir?
No,
It may be
basically
glomerular
what they
nephritis.
have commented, no renal calculi, but what about the kidney condition, what they have commented, whether it looks like a medical
Uh,
renal disease, cortex, how is the cortex,
no,
renal
sir.
cortex?
No, everything is okay. Nothing is there abnormal. म्हणजे pathological nothing is there.
Do the serum creatinine and blood urea.
हा मी उद्या सांगितले ते. आणि
You
सर एक
hmm,
क्वेश्चन होता माझा.
hmm,
USG केलं ना त्याच्यात आता हा रिपोर्ट आलाय की देर इज अ सिस्टिक लिजन ऑफ साइज 3.82 into 3.9 centimeter seen in left adnexa left ovary is
hmm,
not seen separately from cyst.
hmm,
हा म्हणजे एवढंच हेच फाइंडिंग आहे आता ते. म्हणजे मग मी गायनोकॉलॉजिस्ट नाही तर कन्सल्ट केलं
hmm,
तर त्या म्हटलंय की इट इज अ ओव्हॅरियन सिस्ट, देन एज 65 आहे, मग आपण ते रूल आउट करायला पाहिजे, ते कुडी बी मॅलिग्नंट असं.
Most important thing, do the ESR, then serum creatinine, blood urea, then
ESR is 89 sir.
hmm,
89 ESR is.
ESR is too high, then you have to specifically evaluate the case before starting any medicine. That is more important because you must know what may be the pathology, why the patient is
Yes.
having. If there is a growth or cystic lesion near the adnexia, yes, definitely
Hmm.
whatever she said is correct. It might be one
Correct.
of the possibility because of which the kidney can get compromised, and there
हा.
might be a pathology in kidneys also. So better to
Yes.
investigate before starting any medicine.
Okay, okay sir. Thank you.
Okay.
Okay.
Okay. Good night. We'll meet tomorrow at the same time. Thank you.
Thank you sir.
Good
Good
night.
night.